And then we'll go from there. All right, so it's with great pleasure that Dr. Adina Blickstein is here with us today and her team. She is a holistic child psychiatrist specializing in child psychiatry and integrated energy therapy. She's done a fellowship from Westchester Medical Center and a master's in public health from Columbia University. Dr. Blickstein focuses on repairing, enhancing, and creating sustainable, flourishing, and mutually beneficial parent-child relationships for new or growing practices. Doesn't that sound what we're all looking to do? Driven by firsthand experience working with children during the pandemic and through her own clinical work, she has researched and developed the TRAT protocol, which stands for Trauma-Informed Relational Attunement Training. And she's aimed to equip physicians, parents, and educators with skills proven to enhance resilience and reduce mental health symptoms in children and adolescents. And I was privileged to be a part of the group that got to learn from Dr. Blickstein and have invited her to join us to share what she has learned through her work and to share with her work and to see some case presentations from her team. And with that, I pass it over to Dr. Blickstein and her team.
Okay, so we're going to talk about 3 case presentations today using the attunement model of care. I'm going to give a brief introduction on the attunement model, and then each one of us are going to present their case using the model. Next slide. So we all have to ask ourselves a question. Are we living in an attuned world? So let's go over some stats. We have a rising use of antidepressant prescriptions, 66.3% increase in prescriptions of antidepressants between 2016 and 2022, including a 130% increase for girls. We also have 15% and more patients readmitted to the psychiatric hospital within 30 days of discharge. And out of every 100,000 youth, we have 13.6 that are completing suicide, making it the leading cause of death in young people. So this begs the question, what are we doing and how should we improve? Because even though we're having a rising use in antidepressants, we're also having a rise in completed suicide. So there needs to be another way. So today we're going to talk about what attunement is and why it's so important. And we're going to learn this through the cases. And then after we present, we'll open up to questions. And hopefully, collectively, we can brainstorm about how we can improve the system. Next slide. So in the attunement model, we talk about the stress continuum. We have different levels of stress. And when a child is young and they don't have their needs met, they generally get hyperactive, agitated, frenzied, inattentive, and perhaps obsessive. So we lump all these diagnoses into one and call this hyperactive dysregulation. Within the attunement score, highest attuned parents have kids who only do hyperactive dysregulation. So for example, if a child's upset, they start getting inattentive. If a highly attuned parent is with that child, the child won't escalate into hypoactivity or dissociative. So that is correlated with a high attunement score on the parent. The second level goes into hypoactive dysregulation when a child's need is not being met and they feel helpless or hopeless that their needs will be met. They go into isolative behavior, lack of motivation, withdrawal, and depression. And we lump all of those diagnoses and symptoms into hypoactive dysregulation. Parents who are moderately attuned have kids that can escalate into hypoactive level. And then if their needs consistently and accumulatively over time are not met, they can go into dissociative dysregulation, in which they lose connection with their bodies, they can dissociate, they can become psychotic, or they can revert to substance abuse to essentially dissociate from the body through altered states of consciousness. And those are correlated with parents with low attunement scores within the scoring model. Next slide. So these are basic principles of the attunement spectrum. On a qualitative level, it's a personality choice. We call this a personality choice because if one chooses to be on the low end of attunement, we call that narcissistic. And their relationship choice is transactional. It does not involve heart, it does not involve attunement. On the opposite end of the spectrum, people can make a personality choice to be attuned, and their relationship choice is relational and connected. So in this model, just one second, in this model, the opposite of an attuned parent is a narcissistic parent. In other words, an inability, lack of willingness, or lack of skills to understand the child's perspective. Now, I have not met a parent yet who wants to be narcissistic. Most parents don't know how to move along this spectrum. They don't have the skill set to do so. And this is what we do with families. Next slide. So we do have an assessment that measures their attunement score through a self-reported survey, as well as a questionnaire for their children. And the highest reactivity within the parent-child relationship correlates with the lowest level of attunement scores in the parents. And the highest level of attunement scores correlates with the most intimate, validating, and connected relationship with the children. Next slide. So essentially, if a parent is on the left side of the attunement spectrum, they are one of the three narcissistic parent types. And of course, these are broad categories. We have the grandiose narcissist, the rescue narcissist, and the victim narcissist. Essentially, the grandiose narcissistic parent is inflammatory, loud, and hostile. They make the child feel unworthy. And if there is no intervention, the child grows up being a D child, dramatic, attention-seeking, and perhaps with the diagnosis of narcissistic or borderline personality disorder. The rescue parent type always wants to save their child. Another word for this is helicopter parent or fix-it parent, in which they don't really have an emotional connection with their children. It's largely transactional. A lot of these parents usually can use money to provide the financial needs of their children, but they're not really connecting on an intimate level because they don't feel they have needs. They own their child's problems. They don't allow their children to solve their own problem, and they create inadequacy in the child. The child then grows up feeling entitled, dependent, and we call those the baby man or baby woman. The victim narcissist generally has unpredictable moods and feels like they need to be parented. Their flavor in the family is chaotic and unpredictable. They're unstable. They motivate the child with guilt. How come you didn't see your mom? How come you didn't do this? How come you didn't make this? How come you don't care about me? And they create a feeling of insufficiency in the child. They create children who ultimately grow up without intervention, who are compensators, people pleasers, poor boundaries, because they don't feel adequate. They have very low self-esteem. So those are the basic principles. Next slide. Yes, so those are the basic principles of attunement that we're going to hear when we present the case. And so without further ado, I'm going to pass along the mic to Sol. And you can start.
Okay, so I'll be presenting the case on mental health and manhood. And we're going to start by just going through the case overview, reviewing the patient's challenges, and then actually taking a look at the case through the attunement model, looking at attunement solutions, and then the educational takeaways. So the patient that I've been working with is a 28-year-old cisgender male. He is unpartnered. He's living in an apartment with roommates, and he works in technology and sales. His diagnosis is ADHD, generalized anxiety disorder, and dysthymic disorder. He's got low risk of suicidality, and his medications are Zoloft and Ritalin for depression and ADHD, and Xanax for panic attacks. He's got no previous hospitalization. However, 2 years ago, he was in the ER overnight for unrelenting panic attack, and it was de-escalated with benzodiazepines. After that, he sought help and was able to begin working with Dr. Blickstein for the past 2 to 3 years. So let's take a look at the patient. He is 28 and he is very unsatisfied with his work. He is feeling very depleted, very unmotivated. He's got intermittent insomnia, anxiety, and all of this comes through into his personality compensations, where he is avoidant. He distracts himself through video games and substances like weed. He's got trouble sharing answer, feeling responsible for others' emotions, people pleasing, and overall lacking self-confidence, feeling very disempowered. So now looking at this through the attunement model, we are actually going to be looking at the parents and the mom. In the other model, we don't really look at that, but this is where all of these patterns are actually stemming from. So in the patient's case, the mother is a victim narcissist. She's got high anxiety and she had difficulty holding space for the patient's emotions. On the other hand, we had a dad who was a rescuer or a fix-it parent. So he was always trying to solve the child's problems and therefore interjecting inadequacy because they would always not let the patient solve his own problems. So in order, because of that, he does not feel like he is able to solve his own problems. He becomes dependent and unsure of his own desires and his own identity. His attunement score ended up being a 79. And when we look at the dysregulation, that ends up being right in the middle in number 2. So he's already gone through the hyperactive dysregulation and landed himself in the helplessness, isolation, lack of motivation. And he's actually only a few points away from the dissociative regulation. And he's already, going into the substance abuse to regulate himself. And the results of the rescuer archetype is the baby man. The parent is the overfunctioner, the child is the underfunctioner. So the child grows up without having a sense of responsibility for their own problems. They end up becoming entitled. They expect partners or authority figures to act as their parents or to rescue them. And they have very low self-esteem. And all of these are very present in our patient's current life. So here we can see how all of the challenges can be helped through attunements. So we help the patient gain relational awareness, knowing where his patterns are coming from and linking them to relational skills. So for all of the challenges that I already mentioned, we create a profound and deep understanding of relational dynamics to personalize challenges and help him understand that he needs to own his own problems instead of expecting others to fix it for him, to have self-love and appreciation, to be approach-oriented versus avoidant, have healthy boundaries, practice healthy habits, and express his anger in a healthy way. And this leads us to, how does the healthy masculine express himself? So healthy men are connected with their values and their emotions and know how to express them in a healthy way in order to have their relational needs met. Men have emotions too. So anger is often a signal that something is off in a relationship, and learning how to express it in a constructive way is the key to strengthening a relationship rather than damaging. So ever since I've been working with Dr. Blickstein, I've loved this anger protocol, which gives us a step-by-step framework for sharing anger in a healthy way. So step 1 is asking for consent. And this is a very crucial step because you don't want to overburden the other person or interject your emotions without them giving consent and opening the space for you to share that. After that, you say, why you're feeling angry, and you share the story that you made up about it. Like, when you did this, this is what I made up about it. This is how it made me feel. This is how I saw you, just so that they understand where it's coming from. And then the last step is asking, how can we do this better together? So showing that there is an openness for collaboration so that they can come to a solution together. And then the key takeaways here are that a lack of attunement results in children with dysregulated nervous system, which leads them to have mental and physical health issues. And kids model and compensate for maladaptive patterns of behavior. And without intervention, these persist into adulthood. However, when a person gets a sense of unconditional loving support, there is really no reason for their body to be reactive. And that is why the attunement model is so effective. Thank you.
Thank you, Sol. That was amazing. We will open it up to questions after the last case, but we are now going to case number 2. And Kelly, please take it away.
Everyone. So I'm case 2. This is my story of attunement, a personal story of awakening the feminine power inside of me and reconnecting to my daughter. So this is a little strange because this is about me. So here's my demographics. 49 years old. I've joint custody of my 13-year-old daughter with my ex-husband. She lives with both of us part-time. I have a boyfriend of 5 years. He does not live with me. I own my own home. I'm a life coach. I do women's empowerment events. I'm an author, illustrator. And I was presented being just exhausted and tired, not being able to sleep. I'm feeling powerless and just totally disconnected from my daughter. I'm not on any medication. My constant complaints was slamming the door. Not me, her. Rolling eyes, yelling. Most of our conversations turned out to be a fight. It's total frustration. We were both blaming each other. So I reached out to Adina to get some help when I felt like she's slipping away. I don't want to lose her. She's 13. So this is, next slide, please. And this is about my daughter. So she lives with mom and dad part-time. She's in middle school. She loves her friends, music, all things skincare. She's just as frustrated as I was and tired and feeling powerless and misunderstood. She's not on any medication. And her chief complaint is that she's blamed for everything. She just wants to be left alone. And she doesn't understand why I'm so extra, quote unquote. That's what she calls me. My mom is extra. So I thought help because we were not connecting at all. She would yes me to death and then do whatever she pleased. Next slide, please. So this is our on attune model. So I am entity A. So I was working from what I knew, right? What my mom taught me, clean your room, do this, do that. You have to look a certain way. And, so I was taking all that control, thinking I was collaborating, but really I was just controlling. And I was blaming and shaming and guilting her. And entity B is her. So she was feeling wronged, and that guilt and shame was coming through really strong and moody, always angry. And together we were entity C, which is our family flavor, which is we don't belong here. We don't feel safe to be heard or seen. We're not accepting each other. I'm overcompensating, trying to do everything I can, every book and whatever, trying to make this better. And it was just off balance. So this is just like a little review of the narcissistic parenting type, because I'm going to use this in my next slide. So you can go next. So this is my daughter's attunement map. So she is in the middle. I am my narcissistic type that I found out I was, which it freaked me out when I heard I had narcissistic tendencies, because obviously I put all that on my ex-husband because, that's just how we work. But I was like, a victim and a rescuer. I didn't have good boundaries. I was people pleasing. I didn't have good decision-making skills, but I was very high functioning. If I could keep going, then I must be doing a good job. If I can just find the next right thing, it's going to make it better. I felt unsafe to voice my opinions and belittled for going against the grain. And my ex-husband, he had a lack of boundaries, even though he was a grandiose narcissist. He, put on the persona that he knew everything. Everything was beautiful. Everybody was perfect and people pleasing. So my daughter, with us and all our issues, she got kind of some of the same traits, people pleasing and being angry and frustrated and lack of motivation. Can I? Thank you. So this is my maternal family. So this would be my daughter's grandparents. So my maternal mom was a rescuer and a victim. She knew it all, right? She played the guilt card frequently. You have to do this to get that. I can do it better. Very controlling. I know what's best for you. And it was very conditional love, right? Do what I do and you'll be good. And my father had the grandiose narcissist traits. So he was in charge, right? He said what goes. Everybody in the house followed his mood. If he was in a crappy mood, just watch out, just go on your own. He wasn't very trustworthy. Money was king. Everything was about money or control. But basically, when it came down to, it was like the man baby, right? He was just like kind of like a child in an adult body. If dinner wasn't made, a certain time and it was late, he like had a fit, so I was watching all that, and then I just became that victim rescuer to fit in. And yeah, I stayed quiet, I stayed small. I was people pleasing just to get that love, because if I was what everybody wanted, then they would love me. And I pass that on. So we can, so my family flavor growing up, walking on eggshells, a lot of yelling, a lot of, roller coaster environment, emotionally unsafe, money. That's, that's how it was. And then when I realized that I was doing the same thing to my daughter in another, not belonging, not accepting. So we were totally unattuned, which I had no idea that was even a thing. So this is the enmeshment pattern. So this is what was happening with me. My mother was taking control, telling me what to do, how to do it. And the victim, we were making her upset. We were making her sad. She was doing all this for us. And my father was just in charge. He's the boss. And crazy enough, this is exactly what what my daughter was going through. I was the rescue narcissist and the victim narcissist, and my ex was a grandiose narcissist. So this is a real wake up call, like, oh wow. So this is how I became attuned. So these are my attunements. So I had to learn how to be independent of my daughter, right? I was no longer that needy mom that wanted to plan my whole week around her and what she was going to do, and if she wanted to like play with me, right? I made my relationship with her everything. My victimhood, I stopped projecting at her. I became more confident. I, you know, I could now hang on, be like, okay, I'm going to do this right now. If you want to join, you can, but if not, it's okay. I'm not letting it ruin my day. I became an active listener, listening without the intent to reply, really listening, not interrupting or guessing what she was going to say. And I really had to step back for this because I am really good at giving directions. So this takes a lot of like shutting my mouth and going with her in the moment. If she loses something really important, like I don't know, her favorite lip gloss, she loses her lip gloss and she has 25 other ones and she's freaking out, instead of saying, you know what, you have 25 other ones, let's move on. I have to be with her and be like, I know you're really upset. This was the strawberry one and you really liked it. And I have to be with her there and understand and just be an active listener instead of trying to fix it. I claimed my feminine power. I had to go within and hear that little girl that wasn't getting her needs met and tell her it was okay. Tell her it's okay and hold her hand and move forward. I had to affirm my worth from the inside out and not always trying to get it from other people. I'm creating healthy boundaries for myself, healthy boundaries with my daughter, self-care and grounding, learning how to ground when things got crazy. Thank you for the meditation. That was really good. And refining my parental role. That was huge. I thought it was my job to tell her what she had to do and to like kind of, you know, be in charge, but I had to guide her. I had to help. I didn't have to do for her. The boundaries and learning Adina's, this is a great game. Whose problem is it anyway? You miss the bus. Whose problem is it that you're missing the bus? And getting to know each other on soul level with no titles. So I don't own you. You're my child, but I don't own you. You don't own me. We're our own people. And now this is our attuned model. So the mom is more confident and collaborative, calm, grounded, just more comfortable in her skin. My daughter is now loving and more silly. She's always coming up behind me, giving me like that hug that knocks the wind out of you. She's comfortable, she's curious, we have like big long conversations, and we just feel like we belong. This is our family, and we both belong here. The good days, the bad days, the ugly, we just get through it because we accept each other and we've learned to really grow together. And I just want to touch a little bit on feminine power. And I believe feminine power comes from some kind of like disconnect, like a rupture, maybe, I don't know, it could be a divorce, could be someone passing away, it could be just being totally burnt out and fried and over functioning. You know, just the whole cycle that you have to go into the darkness. You have to see how that feels and you have to move through it. We have to learn to heal, you know, all those parts of us that are their needs were not met. We have to make them feel safe. And then we start trusting ourselves from the inside out, trusting our ability to make decisions, trusting our ability to get through whatever we need to make good choices. Our action comes from the internal knowing helps us take action, make better choices, and helps us be in flow, being able to step back, see how things are going, do what feels good. And it's a whole entire circle, and we just get better and better at it. And I just want to end with like a quote, you know, learning how to attune myself to my family has changed our relationship and our world forever. Because it has. It's like 100% better. Before she was slamming the door in my face, and now she just like comes and sits on my lap and is like, "What are you doing?" You know, it's just such a world of difference. And yes. So thank you for listening.
Thank you so much, Kelly. It's so impactful to be able to share your personal story of attunement. And, you know, I'm sure we all work with families and have our own families. And I know that there's a deep desire in every parent to be close to their child, and there's a deep desire in every child to be close to their parent. And I think we just sometimes lack the skill set to foster that beautiful intimacy. So thank you so much. Wonderful. So we talked about a case with a man, and now we talked about the case of a woman and feminine power, and now we're going to talk about a case of an entire family and how we're bringing unity to the family system and family structure. So this is going to be presented by Aurelis. Please. Yes.
Hi, everyone. Good afternoon. So as Dr. Blixen just said, we spoke about individuals, but there's actually a lot of the attunement is about the relational interactions between an entire family. And so now I'm going to kind of educate on that. So to start, there is through the NIH, they saw that 19% of the population in the US has been exposed to parental alienating behaviors. So what does that mean? An alienating parent is someone who's undermining and discrediting the other parent. They don't know what they're talking about, things like that. And the target parent then gets alienated, right? They get discredited, they are sabotaged, they are getting undermined, and that's obviously having an impact on the children's mental health. So most families in the divorce process don't choose to reunify because the only access to conflict resolution that a lot of these families have is through family court system, which is not always the best. So they're going through that system, and then that's just perpetuating the conflict and kind of, you know, it becomes cyclical, impacting the child's mental health. But there is another option. There is Dr. Blixen, who does the family reunification using the attunement model. So it's basically finding a balance and having the parental alienation instead foster some instead like finding their way back together. There's different ways that they can be alienated. It could be physical, right? If someone's incarcerated versus emotional, someone's living in the same house, but they're not actually expressing what they think, or they're not allowed to, things like that. So there's a lot of ways to be alienated. And the problem with some of this alienation is then, or just general conflict in the parent, is that then you can cause child triangulation. So that's like the typical image that people may have of a divorced couple, where there's like a tightrope, right? And the kid is in the middle, and the dad is saying, oh, your mom doesn't love you. And the mom is saying, oh, your dad is silly or whatever. And you know, it causes obviously a lot of strife in the home, and also then impacts the child. All right, so with all that, my case is about 3 people, a 47-year-old female, 45-year-old male, and their 6-year-old son. The mom works in special ed, the father does sales. In terms of psychiatric history, the father has substance abuse disorder, alcohol specifically, but he's been sober for over 10 years. But 1 year ago, he relapsed secondary to fighting with his parents. He has substance use disorder, high anxiety, and unspecified mood disorder. He is on Wellbutrin 150, recently decreased from 300, and Seroquel 50 at night. The mom does not take medication and yeah, has no official diagnoses. Reason for alienation, though, is actually that there was erratic behavior by the father in front of an outpatient clinic, and CPS got involved. At that point, CPS forced the father to sign a neglect case and forced the mom to sign a restraining order. So actually, the alienation was like entity X, right? CPS, not either of them. So if we're thinking about the father here and those levels of dysregulation, he's already passed the hyperactive and the hypoactive. He's now dissociative at this moment in time, right? When he's outside this clinic, right? Because he's becoming completely detached and just erratic. So this is their personal timeline. The father had that episode in like 2022. CPS made them sign the neglect and the restraining order, respectively, and then they made him go to detox. He was discharged to psychiatry and AA, and all of his visitations with the son are supervised by the mom. Then in September, he finds Dr. Blickstein, who agrees to provide a safe reunification contingent on his stability and him sticking to his own terms, sticking to the terms that they come to together. And then actually this past week, in exciting news and also a little sad, they signed a reunification contract, which Dr. Blickstein is gonna combine with the CPS contract. So this is their old song, where they were unattuned. And when you're unattuned, you're gonna like stick in your cycle, right? So the father is the grandiose narcissist. I don't do anything wrong. Like what I say goes, you know, it's kind of erratic. It's all over the place. And the mother is the rescue narcissist. Like she believes that she can fix him. Any Taylor Swift fans out there knows this song. You know, she can fix him. I can do it. It'll be fine. You know, kind of not setting her own boundaries. The problem is that if they stay unattuned and they're in this cycle, then there's going to be an impact on the son, right? More than just right now. But long term, like he's going to feel invalidated, repressed. Eventually, it can lead to guilt and anxiety. And ultimately, like when he grows up, he can become what Dr. Blickstein calls the dramatic man, which is overly aggressive and controlling, aka his dad. So this is just like another way to say basically what I just said. But the unattuned model is that the mom, again, wants to rescue. She can't set the boundaries. She's people pleasing. She's excusing behavior. The dad is abusive, grandiose. He's always right. He's deceptive. And because of that, the child is guilty. The child's anxious, and the child has freeze reactions, doesn't know what to do in conflict. So how do we prevent the parental alienation and the child triangulation? So actually, Dr. Blickstein has a 6-page contract, at least for this couple. And one of the terms of termination is actually triangulation. She says triangulation is a form of abuse, and any reported triangulation will result in immediate contract termination. Why is this important? Because the whole point in her reunification process is that there's a safe space for everyone, right? It's no longer the model that we all know where it's family therapy and it's really like the kid's problem. Now it's like it's everyone's problem. Like, let's all share this responsibility. We all need this safe space. We all need to have our own safe space for each other and for ourselves. And then part of the termination is that if it gets terminated, then this case goes right back to CPS. And obviously that's not always the best case scenario, as we've seen. So the potential for a new song with her contract would be to be attuned. So what does that mean? Just a more healthy dynamic where they're taking turns, right? The dad gets to be the nurturer and the mom gets to be the nurturer, and then they both get to be on the receiving end as well, that they're reiterating and validating each other's concerns. And the most important, that they can actually see the other person's perspective and be genuine about trying to, understand where they're coming from. And again, the same thing, just reiterated that, if they can become attuned, then the mom can have more trust. She can be more confident. And really importantly, she can set her own boundaries. And the dad can be accountable. He can own his own problems, and he can be able to apologize in a real, genuine way. Ultimately, that leads to like a safe relationship that's transparent, that's honest, and just a healthy growing ground for their kid. So in terms of enmeshment patterns, just for the visual learners out here, the current family dynamic, if you look at the arrows and you think of that as like the dad, and the big circle is the mom, and the circle in the middle is the child, then the dad is kind of not letting that mom have her safe space, right? He's like coming in aggressively and kind of like breaking her up. The mom is still able to help the child, but as you can see, the child's somewhat disrupted by this dysfunction as well. And I'm sure over time it gets worse and worse. But with help, then they can become this balanced family. And again, it doesn't have to be typical mom, dad, child, like it can be whatever. But that the point is that each parent has their own space for themselves, and also to hold the other team members to create kind of this safe space. Thank you.